Attention Springfield Ambulance. Attention Springfield Ambulance. Please respond code 3 to a possible heart attack at 2325 South Thompson Lane. Patient is a 53-year-old male complaining of chest pain and difficulty breathing.
Springfield Ambulance copies en route to 2325 South Thompson Lane, code 3 for possible heart attack. Can you advise on any medical history?
Springfield Ambulance en route 0430. Affirmative. Patient's wife states he has had heart issues in the past and is on several medications. She states pain is getting worse and breathing is becoming more difficult.
Copy, thank you. Please contact Mercy Hospital and advise them we will transmit ECG and vitals once on scene and have them stand by for possible helicopter transport and cath lab activation.
Each year, more than 500,000 Americans experience ST elevation myocardial infarction, STEMI, out-of-hospital cardiac arrest, or both. The majority of these patients don't receive appropriate treatment for their life-threatening conditions within recommended timeframes. The outcome of a STEMI heart attack depends entirely on the care a patient receives and how quickly they receive it. South Dakota has 66 counties covering 76,000 square miles. Yet through the American Heart Association and Mission Lifeline South Dakota, we're saving lives and have become a model system for rural states across the nation. Mission Lifeline South Dakota created a STEMI heart attack system of care across the state, which, 1, enables swift identification of a STEMI in the field by emergency medical personnel trained to use 12-lead ECG equipment. 2, transmission of the ECG results from ambulances to hospital personnel. This enables activation of STEMI protocols and cardiac catheterization lab teams prior to the patient arriving at the hospital and facilitates rapid treatment. 3, provide essential data and feedback for hospital and EMS personnel to continue to improve patient outcomes.
It's a new standard in rural care.
It's a new standard of rural care.
It's a new standard of rural care.
It's a new standard of rural care.
Every ambulance from Bison to Buffalo, it has the same capabilities to be able to do the same training identical throughout the state, making sure that all the patients are going to be treated exactly the same.
So today we are training basics, intermediates, and paramedics in capturing 12-lead devices and transmitting them to hospitals, whereas before that never happened. When somebody's experiencing heart attack symptoms and calls 911, the first thing that happens is EMS system is activated and dispatched to their local address.
Typically they have a BLS service that shows up and they don't always have all the equipment, they don't have all the testing equipment to be able to determine if that patient's highly acute or not. In South Dakota, through the Mission Lifeline initiative, we now have those capabilities statewide, which is a huge benefit to all the visitors to our state as well as all the people that live in our great state.
Transmission, it's knowing what's going on with the patient before they reach the hospital, and it's having an idea of how to, tailor that patient's treatment before they reach our doors.
What we've trained EMS to do in this state is EMT basics, intermediates, advanced, and paramedics is to identify them in their own home and to alert the hospital early.
Identifying the patient at home makes it a lot easier to determine what we need to do when they reach the hospital. It saves us time and in a situation where time is very important.
The sooner we have people ready and waiting, the faster we can treat those patients.
Outcomes of our patients have improved tremendously in South Dakota just by having EMTs, basics, intermediates, and paramedics transmit an EKG to the hospital, alerting the hospital of that situation, of what's coming in. We aren't even taking them off our cot once we get into the ER. Interventions are being done in the emergency room while this patient is still on the ambulance cot. We're turning around, loading them back in the ambulance within 15-20 minutes of door in the ER to door out again and heading straight to a PCI center to help benefit this patient to open up those clogged arteries in the heart and salvage their heart muscle.
When we can see the electrocardiogram, or the heart tracing as it's known as, we can determine that there may be damage to the heart going on, and this affects how we treat that patient.
We're able to tailor treatments for the specific types of heart attacks patients have in a timely fashion, and also activate cath labs sooner and get patients to appropriate facilities faster through this transmission, so it's critically important.
Mission Lifeline is by far in South Dakota the most progressive thing that's ever happened as far as cardiac care. Outcomes of our patients have improved tremendously in South Dakota.
And I think Mission Lifeline has given patients that would not otherwise have a chance at survival that chance due to this improved transmission.
Through Mission Lifeline, data collection and analysis has provided us with valuable feedback on what areas of care can be improved and enhance patient outcomes.
Distance shouldn't matter. It shouldn't matter if you live in Rapid City, South Dakota or Newell, South Dakota. You should have an opportunity to get the best care possible. By putting the standards of practices into place and communicating with all of our facilities and our ambulance services, it means everybody, no matter how far away you live, is going to get the best treatment possible.
We need our patients' help to call 911 when experiencing chest pain, so this technology can be utilized to save their lives.
I think Mission Lifeline has really helped bridge that gap. It's given these small rural ambulance services equipment they would never have been able to buy. In the past, they've had to have street dances, bake sales to be able to buy a 12-lead EKG. So it has allowed them to have equipment and help take care of these patients in a way they never maybe would have been able to.
Mission Lifeline came to South Dakota and helped us unify a 76,000 square mile area in the care of 750,000 patients in South Dakota.
Time is crucial, so having an excellent system of care that facilitates identification of the issue, initiation of therapy for heart attack patients, and a system that expedites transportation across our rural states ultimately results in truly saving lives.
Regardless of whether a patient is in rural South Dakota, either West River, East River, that they all get treated with the same standard of care across the whole spectrum of patients.
We are one of the first rural states in our country that have been so affected by the generous gift from the Helmsley Charitable Trust, which enabled us to create one of the most comprehensive systems of care for acute heart attack patients in the country.
Most of the things that happen in the country, we think that the movers and shakers are on the coast. Here in South Dakota, I want you to know that we're rocking the cardiology world and making an example here for anyone else in the country to follow.
I think other rural states will follow our lead, and that we've kind of set the standard, and they will follow and work with us and try and improve the care in their own state.
We have mobilized the resources of our EMS systems and leveraged them to be able to offer the rural patient in South Dakota the same opportunity that would be afforded if you lived in downtown Manhattan or San Francisco, California.
Above all, Mission Lifeline has allowed us to implement a very comprehensive, one of the best in the world, in fact, I believe, systems of care that help patients with acute myocardial infarctions initiate care, take care of them, expedite transportation, and ultimately save lives.
Mission Lifeline South Dakota, changing the landscape for cardiac care throughout our state, saving lives.
It's a new standard of rural care.
It's a new standard in rural care.
It's a new standard of rural care.
It's a new standard of rural care.